My name is Pat Iyer, and I have with me Ethel Wills, who is a legal nurse consultant and a nursing home expert. And we've been chatting about a serious issue in nursing homes that can lead to residents dying, and that is dehydration and malnutrition. Ethel is a person who reviews cases and testifies about a variety of long-term care issues. And this is one that comes into her office on a fairly common basis. Ethel, could you give our watcher who's watching this on our YouTube channel or listening to it on the audio channels a little bit of a sense of what we covered in your podcast?
Pat, there's some of the things that we covered was the vulnerability of the elderly to both dehydration and malnutrition because of their weakened state, their frailty, and also possibility because of their other health issues that may be plagued by, such as dementia, Parkinson's, those types of things. And also there's this assessment of the person, the elderly, for risk factors for dehydration and malnutrition was another thing we covered, such as having poor oral health, broken teeth, poor fitting dentures, and then being the importance of having those things assessed. Swallowing issues was another thing that possibly could lead to both those factors. And then there's need for an assessment of those. The lab work, if there's a concern for malnutrition, dehydration, we also discuss what labs to look for. Look at the protein levels, such as prealbumin, albumin level, the sodium level in the blood, the potassium level, and also look at the urinalysis, such as the urine color. And then feeding environment was also another thing we covered. It's much different in the nursing home than in the hospital. There's not a community where there's a person walking down the hall passing trays. The residents are all taken to a dining room, such a community dining room. And there's assistance being offered if needed for someone to be fed, and also persons to engage with at the next table. There's a need to encourage eating, and a lot of times that's done by putting in an environment where others are eating. And another thing we covered was the need for nutrition assessment, looking at nutrition assessment, whether or not that person was assessed when they came in for the basic needs, caloric needs, fluid needs, and the weight, and whether or not there was what adequate intake is considered sufficient to be maintained to maintain that weight level. And the role of the CNA was also discussed. This CNA assists with feeding. Also, the CNA also records all that, the weights and the intakes, and whether or not that person was incontinent. Those are factors. Incontinence is a factor that can cause, if there's a lot of diarrhea, that type of thing, it can cause dehydration. And those are things that they should be looking for. And those are some of the things we also discuss. In a nutshell, there's a lot of different factors that can cause dehydration that should be assessed, a lot of issues that can cause malnutrition. And then legal nurse consultant evaluating that record should look for several different factors. Look at the medical records to see what baseline care plan was done, what's on the care plan, and whether or not the care plan was being followed.
There are so many things that we covered. Now, Ethel, as you do that summary, it reminds me of the many topics that we addressed in talking about the LNC's analysis of dehydration and malnutrition. This is an area that requires an analytical thinking and sometimes a bit of skepticism. Ethel brought out in her podcast that if you're looking at a food intake sheet that shows 100% of the meal was consumed by the resident, and yet the resident is losing weight, you need, as the legal nurse consultant, to put that through your filter and think about, is that indeed accurate documentation? Or was somebody just going through the forms, checking the charts, writing things by rote without that information being accurate? You'll learn more about that, as well as all the factors that Ethel described in her podcast, by catching Ethel Wills' podcast as we talk about dehydration and malnutrition in the nursing home environment on Legal Nurse Podcast. Be sure to get her show and take notes. You're going to find a lot of nuggets in what she shares.